Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.
Dandruff is one of the most misunderstood personal afflictions. Because it develops from the scalp, it's considered a skin condition, as explained by dermatologist Dr. Dilshaad Asmal.
Dandruff is a dermatological condition of the scalp. What happens over here is that we have white or greyish, brownish looking scales that are being renewed at an accelerated rate. So your normal skin cells are renewed, and think of them as just becoming faster and faster. So hence, you have your old skin cells dying at a rate that's more than what a normal skin would be.
Dandruff doesn't always come with visual evidence. Some sufferers might not notice the telltale white flakes, but complain about an itchy scalp instead.
Dandruff, if I'm going to sound really intelligent, is called pityriasis capitis, and it's a low grade of an eczema. The more intense kind would be something called a seborrheic dermatitis, and that would be where you'd have your scaly scalp with the associated inflammation. We must remember that seborrheic dermatitis is an inflamed, scaly, itchy condition of the skin, and people misdiagnose this as being dandruff. And it can actually happen in other places besides the scalp, like around the eyes, in between the eyebrows, around the nose, around the chest area. So hence, we can't call it dandruff.
Dandruff can be caused by a sensitivity to certain hair products, by a general predisposition to eczema, by not shampooing and cleaning the scalp regularly, or even just from simple dry skin on the scalp.
Dandruff is not age or gender specific. One must remember that it can be found more in post-pubertal patients, and that's when it can become socially unacceptable, because the patient can be scratching their scalp because it could be itchy, and then you also can have the little brown or the white flakes on the clothes, and then it becomes socially embarrassing for the patient. So that's a good time to get treatment.
Good hair care can not only prevent dandruff, but you can also get advice on treatment from your hair care professional. Calvin Rom from Gary Rom Hairdressing offers his advice on dandruff.
If you had to find out or be told that you've got dandruff or a really dry scalp, definitely visit your local hairdressing salon and do an in-salon treatment. Often you'll find when you use a shampoo or a treatment, the scalp will get worse before it gets better, because it works as like an exfoliating cream where it removes all the dry and dead skin before it starts to get better.
Your hair care professional can also help you maintain a healthy scalp, which minimizes your risk of developing dandruff.
In order for you to maintain a healthy moisturized scalp, you always need to use professional hair care. That's the single most important thing for you to use. Your scalp's part of your skin, so the minute your skin gets dry, the same thing happens to your scalp, all right? And the only way to maintain that, like I said earlier, is to use a professional shampoo and conditioner and consult with your local hairdresser so that he or she can make the right recommendation for your scalp.
Dandruff can be treated with over-the-counter medicated shampoos, but if the symptoms do not improve, it's time to get a second opinion.
If we find that there is no relief of the symptoms or the signs of dandruff, then a patient needs to be seen by their GP or their dermatologist to be accurately diagnosed and to make sure it's not a form of seborrheic eczema.
Don't let dandruff get you down. Seek professional advice, get treatment, and then let your hair down and relax.
Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.